So depending on the exact training that the therapist has had, or the touch practitioner, I should say. Um, so for example, if they have had the touch component just within the somatic experiencing training, um, again, we might invite the client to lay on the table, fully clothed, etc., getting the body as comfortable as possible. Then what the practitioner is going to do is probably start at the joints. The joints tend to hold a lot of activation, within the system, because they act as, I think of it as like a surge protector. When there's a lot of activation flowing through, if a client is really triggered with something, there's going to be a lot of energy moving through the body. We're electrochemical in nature. That's how neurons work. So there is an energy that's connected with that. So because the joints tend to act like surge protectors, they can hold a lot of energy. So I might start, for example, just holding, here, I'll pretend I'm the client here. Actually, I'll do it this way so you can see a little better. So if the client's arm is down, I might ask permission, of course, to come underneath and just gently hold the client's wrist, for example, because that is a joint. And what I'm listening for through my touch, and this isn't just with joints, but with any touch, is I'm listening for, I should say, what I'm looking to feel in my hand is increased pulsation, because that indicates that more blood flow is coming to that area. The muscles are relaxing, as they get support from the outside. So I'm listening for that pulsation, and also listening through my hands for a change in the energy pattern. Typically, if there's a lot of activation being held in the area that I'm touching, it sort of reminds me a little bit of disorganization, like hearing static, something like that. So I'm going to listen through my hands for more organization in the pattern of the energy. It might slow down, it might start to form a pattern like a circle or a wave, kind of an infinity sign. It really varies from person to person. It's fascinating, really. I don't really have an explanation for it, but folks that work with the body do further develop the ability to notice these things. We all have the ability to notice them, but for many of us, if we don't practice, we don't develop that skill. So with other clients, I might be starting again with the brain stem, holding underneath the head. I might be going to the kidney adrenals, the viscera, which tends to hold a lot of activation, especially from early developmental trauma. Where I touch is going to be informed by the readiness of the client's system to receive that touch, the capacity they have to feel the support or to take in the support. That's probably a better way to talk about it. So it's going to vary from client to client. I don't know that there's any two sessions that are exactly alike. And then I would also add, again, in the somatic experiencing training, there's one entire 6-day module that's devoted to touch. And if people are really interested, if the practitioner is interested in learning more, generally speaking, they're going to take other touch trainings that also inform their practice. I've taken maybe 3 or 4 other trainings, actually at least 4, because I'm really interested in this. That's in part because I had such a profound experience with touch myself. When I was in the advanced training in somatic experiencing, I noticed that about 1/3 of the students in the class and the assistants were body workers. And that stunned me because I came from a class here in the Chicago area that was all psychotherapists. So I was curious about, well, how did these body workers approach this? So I requested a personal session with one of the assistants, the more experienced people that were there assisting the training. And she was a body worker, and I had a profound experience with that physically kind of changed how my body was working. and it lasted for a good 3 weeks. So I really became a believer in the power of this work through touch to make real changes in the lives of clients. And that's why I continue to study and to learn and to bring that learning to clients for their benefit.